Hey guys, it's Wendy here. I want to go over some pregnancy testing with you, just so we can make sure everyone is on the same page and that we can have everyone checked off. And really all this does is help allow us to allow all of our volunteer counselors to be able to perform pregnancy tests. And I know you've been doing it for a long time, but now we have to make ourselves legal and legitimate and have you watch this video and take a little quiz and put that in your record so that we can say that we have checked you off on the pregnancy test. Please don't let the quiz scare you. I will walk you through it and tell you what it is, but it just allows us to have a piece of paper on hand that says that you know what you're doing and we've checked you off. So this video, I'm just going to walk you through the steps of the pregnancy test that we do here in the clinic, and then you can stop it, take your test, and then restart the video, and we will go over the test. Most of you know you're going to go to the lab, our bathroom, or our quote-unquote lab, and the patient will put the urine specimen in a dry, clean container on the one side, and you'll be able to pull it out on the other side. Most of you probably already know that the first morning specimen really is the best and usually has the highest concentration of HCG, which is the hormone that we're looking for found in the urine with pregnancy. However, that is not always the case, that the woman or the girl can bring you the first morning specimen, but just know that's how sometimes the results can vary. And even if you do get a questionable result and you want to have her come back, it might be best to tell her to come early in the morning as possible. So just so you know that. So she will pass it through and you'll pull it out on the other side. And you do need to be wearing gloves when you handle urine specimens, so there's a set of gloves for you right there. Those are size medium. If they don't fit you, please let me know. We can get some different ones for you. But you can see the pregnancy test kit will be over on the left in that blue box. Now, most of you have been used to using the FYI pregnancy test, and we're actually changing to a brand called McKesson. It's the same test, it's the same cassette, everything will be the same, it will be read the same, except one little difference will be that the little pipettes that you collect the urine in will come inside the cassette pack. So when you open it up, the little cassette will be in there. So you're going to open up your packet, and please note, open up the packet just before you do the test. Don't ever try to open it up and then go run and do something else. It's best to open it up and then do the test immediately. Here's a picture of what the new box will look like. We're going to try to have these stocked under the sink for you, so they should always be under there. And this is the packet that it looks like. And I want you to know that there is a lot number. If you look down at the bottom, it starts with HCG, and there's an expiration date. Starting from now on, every time we open a box of pregnancy test kit, we're going to run something called a control on it. And if you've ever worked in a lab or been anywhere around a lab, that just helps us know for sure that what we are using gives us the right result. As of right now, I will be performing all those, but if you happen to open one and do it, you can come find me and I'll help you do it. But really what we're doing is running a basic test that we put a solution that gives us a positive result and a negative result, and then we would know that that lot is capable of giving good results. So that's what that is. So it's really important to record the lot number and expiration date, just in case we ever had any trouble. We could come back and look at it. And I'll show you the logbook in just a second. We will have a new logbook located in the lab, and we're still going to keep the old one for a while, but starting probably in the first of the new year, we're just going to be using the new logbook. It's pretty self-explanatory, where you put the initials, their clinic number, the lot number, what the test read, and you can put in the expiration date, and you'll see that on there. So when you perform a test, you're going to take 3 drops of urine from the cup and drop it into the well. And there's a timer there for you, and you can set it and wait 3 minutes. And let's look at some of the ways that test results can be read. With a positive test, the T stands for test and the C stands for control. Just a note, you should always, always, always get a line on the C line or the control line. If you don't, you need to throw the test away and start over, or maybe run the controls and see if there's something wrong with the lot number. But you should always get a line on the C line. But to look at a positive test over there on the left, you'll see that a positive test, the reason they put 2 there is because the one on the left is a little bit darker and the one on the right is a little bit lighter. Those are both still positive tests because there is a line at the T. And so sometimes the pink line may show up pretty fast, and you can kind of be rest assured that you're fully confident that everything's good. A faint line still could mean it's still pregnancy, but a lot of times if it's really faint, you may want to ask the girl to come back give a week later, just to follow up. There are lots of different reasons, as you're well aware, that pregnancy tests can give you a positive like that. It could be different sorts of drugs. It could be lots of different things. So it's always good if you're ever in question to ask them to come back. It's another point of entry and another point of contact for this girl if you need them to come back as well. But a negative test will look like this in the middle, where you just have a C line and nothing on the T. And always remember that a lot of times that white background will turn pink, and then it takes a few minutes for everything to clear up. So always wait your 3 total minutes that there's there. And then the invalid test that I was telling you about, if you do not get something in your C line, then you need to know that the test is invalid. Here's the logbook, the new logbook that you'll see, and you'll see that it's located by months. And so obviously on December 1st, you're going to need to flip it up and move to the next one, etc. If you're the first one there on the first, please do that. And you'll note the timer is also there in the bathroom so that you can time yourself. And always wait for the full 3 minutes just to be sure, because sometimes some lines can show up late. Okay, I'm going to stop here for a minute and let you take the quiz. Remember, this is not to trip you up. This is just to help us have something on file. And you should see here in the folder with you that there is a little instruction booklet that goes along with the test kit if you want to use that to take your test. And then we'll go over it. So hit pause now and take the test. Okay, I hope that was easy enough for you. 13 true, false questions, and I'm going to go over it with you as well now. A pregnancy test, number 1, a pregnancy test is always 100% accurate. And this is false because they are usually 99% accurate, but we cannot call them 100% accurate. Even the manufacturers do not say they're 100% accurate. So just make sure when you're telling a girl this, if there's ever any question, always come back for a retest, or we can see if they need to maybe follow up with their OB for a serum test or even have an ultrasound to follow up to get 100% accuracy. The hormone tested in a pregnancy test is called HCG, or human chorionic gonadotrophin, and that is true. I hope you recognize that we are testing for HCG. Number 3 is gloves need to be worn when performing a pregnancy test, and this is true. We are now with a medical clinic. We are following the blood-borne precautions. So anytime you're using a bodily fluid, you need to wear gloves, and so they're provided for you. So please make sure you do that. Number 4, the test cassette should remain in the sealed pouch until immediately before use. And this is true. That just keeps it from being exposed to the air, any elements that may affect the test results. Number 5, a colored line will always appear in the control line region if the test has been performed properly. This is true. If you do not see a line in the C part of the test kit, then you need to do it over or either open up a new box or something. It's not an accurate test. So please make sure that you throw that one away and repeat it. Note to self, you may want to hold on. I know a lot of times we tend to have a tendency to pour out the urine cup right when we do the test, but you may want to hold on to that until you get the results, just to make sure that all is okay before you do it and you don't have to make the patient void again. Number 6 is to run a test. You need 10 drops of urine on the cassette. That is false. You only need 3. So just remember 10, and if you put too much in there, it might actually affect it. So remember, you only need 3 drops of urine for the cassette. Number 7, the test should be read at the 3-minute mark, and this is true. You probably will get a good result before the 3-minute mark, and you'll probably know what's going to happen, but always wait till the 3-minute mark before you give your official result. Number 8, each new box of pregnancy kits will have a lot number and an expiration date. And this is true, and this is something we need to record. And also remember, when we open a new box, that we will need to run controls in it. Hopefully I will be the one taking care of that, but if you happen to open it up and you don't know what to do, please come find me and I will take care of that for you. Number 10 is very dilute specimens may contain representative levels of HCG. And that is true. You always, but if someone has a very dilute specimen, just know that the test can be faint, or like a faintly positive, I guess. So I just want you to be aware that they can be a dark pink or a light pink result, but as long as there's a pink line, there's HCG in there. Number 11, a positive pregnancy test from our clinic can confirm a pregnancy diagnosis. And this is false. And I only meant to tell you this to help you understand the lingo of this. A positive pregnancy test from our clinic does not give a pregnancy diagnosis. To actually give a diagnosis, we have to do an ultrasound or to confirm it. Now, we can verify that someone was given a pregnancy test in our clinic, and we can give a form saying that they had a positive pregnancy test in our clinic, but to actually give an actual diagnosis, we have to do an ultrasound, have a physician read it, and that can confirm a pregnancy, a medical diagnosis of pregnancy. So just so you understand the difference there. Number 12, there are conditions other than pregnancy that can cause elevated levels of HCG. And this is true. Various drugs can cause it. Different thyroid issues can cause it. So just be aware of that. And number 13, it is okay to shake the cassette to get a result. And that is false. You do not want to shake it to try to hurry it up. You really just want to lay it flat on your surface that you're doing it and leave it there the whole entire time that you're doing it. I hope this video and quiz was helpful. Please make sure that you take your quiz, write your name and your date on it, and that you've watched the video and that I have signed off on your quiz. You can either come find me or leave this on my desk, and I will sign off for this, and this will be put in your file, and we will need to do a check off every year just so we're to make sure that we're up to speed and up to par on our regulations for you to be safe to do a pregnancy test. If you have any questions, come ask me. Thanks for your time.